Hi everyone, this is Dr. Erdogan from Smile Hair Clinic. Today I would like to share with you one of our patients we did this in the past. So we will show you about some photos of him. So we will discuss. So let's begin. Our patient is from Germany. He's 33 years old. We did his operation end of 2022. So now it is almost 13-14 months, but we have the photos of 12 months. So I would like to show it to you. So let's start from the photos that the patient sent us from his country. So this is how it seems from frontal part. A wide forehead. The frontal part is receded from the both temporal part. He has some hairs in the frontal part, but they are very less and very weak. And afterwards, his mid scalp and crown area. So from frontal part till the crown area, he has a wide and a large area with the hair loss problem. The good thing is his temporal part, the lateral hump part, is narrow. If it is too wide, if it's Norwood scale more, at that time we need more grafts to restore that area. So it's a good and a plus thing for our patients, and we really care this when we do the implantations. After he's completing, by the way, he sent us whatever he wants as well. So this is the line Stirnmuskelgrenze. So it means that it is the borders of the muscle. So he wants something like this. In the front, yeah, now whatever I explained to you about those lateral parts here is shown by his drawing, so it looks good. All right, so let's talk about when he is in the clinic, what we take as a photo. It looks a little bit different as the hair color. So sometimes we see different color, different contrast, different hair loss problems than whatever we see in the home taken photos. So it's a little bit different. Yes, he needs in the crown, definitely. He has a large crown area, approximately 80 centimeters square. His frontal part is nearly another 80 centimeters square, and his mid scalp seems good, but nearly 40 centimeters square. So after we checked his donor area, it is very good. Dense, thick, multiple hairs, majority. It appears like that, and when we checked during the examination, we also noticed that too. Once we shave it, it looks good. Maybe his crown area's recession just lowered until his donor area. It starts some here, I can see from the photos. I also noticed that during the operation as well. Then we completed his operation. We drove his line with a little bit more conservative hairline. We didn't lower it too much. We made something similar to patient wanted from us, and it was okay for us for the frontal coverage. We do not recommend with these patients to lower the hairline too much, because at that time we have not enough graft for covering the other parts. When I see this patient, I can say that this patient needs 2-session surgery immediately, because his crown area is large and we need to concentrate on the front. We prioritize his frontal part, so definitely he needs another session in the future, at least 1 year later, when his crown results are completed. At that time we might need another transplant, or sometimes patients are happy with whatever we do or whatever we implant to that area. At that time patients decide not to come to the clinic again. But usually whatever I see with the patients' experiences, they usually definitely come back. I just wanted to show you the post-transplant photos as well after the operation. As you see, the frontal density is very good. I tried to create some irregularities in the frontal part. I did some extensions to here. Density-wise, I think it's good. Here from the top view, as you see, there is a contrast difference between the frontal part, mid scalp, and the crown area. Front is every time more density, then we decrease the density. And this is how it seems from the vertex, the top crown area. Lower density, of course. The graft number is 4,750. Nearly 3,000 is just used for the frontal part, and the remainings are used for the other areas. Okay, that's the post-surgery. Let's talk about his results. Okay, 14 days later, as expected, it is still some red. With sensitive skins, we see more redness with the skin types. it started to grow, especially the both temple parts. Crown is less, but still some hairs on there, but we can see scalp visibility. His donor area started to heal right now. It looks good. Probably it's gonna look better. Okay, so let's talk about the other month. First month. Most of the hairs are just due to shock loss, due to circulation. They just fall off, so we don't see too much about here. Okay, so let's jump to 6 month. At the 6 month results, sometimes we see with the patients that the hairs grow earlier than it is resulted in the 12th month. Yes, we always talk with the patients about it might take 12 to 18 months, but sometimes we see early progress. It doesn't mean and we usually say it's 40% or 50% in the 6 months. Sometimes patients think if it's 40% in the 6 month with this, it will be double in the 12 month. No, it's not like that. The progress is just become early. That's the reason. This is the frontal appearance. I think it looks good. Of course, it doesn't show the both temple parts, but whatever we see with the photos, I think patient is already happy with this appearance. So it looks good. Donor area healed perfectly, nothing left. It looks perfectly. Crown area, it's better than I was expecting for a 6 month result, and even though because we did the low density implantation, it looks good. Sides are important. Yes, you can see in the 6 month photo that in the sides it's still not the desired density, but somehow it is okay from the front. Somehow the patient probably is happy due to his previous photos, but still we are searching for more density, and it will come up in the next months. And from top, I will show you the other photo. Because it's a little bit longer, it covers most of the areas, but still good. We are always telling the patients about one thing. It's very important, I think, guys. Once we have receding hairline, we are losing the structure of the hair, or the hair just falls off at that time. Until 50%, patients is still happy and people do not notice until that time. But if it is going lower than that, at that time people will tell you that you have something on your front with the recession receding, or your density in the front, it doesn't look nice. So we try to catch that thing when we do the implantation. So if it's more than 50% of the total density as before, patient is happy at that time. So it is some kind of like that, but still we are expecting for the other months to be growing more. Okay, let's see 9th month. Much better. The front is looking very perfectly. It's not very understandable. No one might say it is a hair transplantation. His donor seems much better. Sides, it's covering from the right side. You can't understand how the directions goes off, but maybe yes, left side gives more opinion for us. It looks good in the frontal part. It's very natural as well. We keep that Z angle. We keep both temple point and temple point to temporal area angle. I think it looks good, and it's looking perfectly natural for his frontal part. I always want to start from patients in the central part and to take little tilt up in the temple part. So I try to do that with this patient, and it works on you. It works very well on him. From the top appearance, it looks better. Still some temporal needs in the both temple parts, but it's much more density, as you see. So final. Let's see 12th month result. Yes, much better, more dense, because after the 7th or 8th month, we usually see more thickening effect with the frontal areas hairs. Now we see it, and it's very good. It's very natural. It's very dense, by the way. Even we didn't do too high density, we catch the right density for him. How it looked from top, you can't notice. You can't say that anything he needs in the temple part or frontal part or mid scalp. It's perfectly density. His donor area, nothing. You can't notice any transplantation marks. Of course, if it is shaven, it will be more, but with this length, it is already covered. Sides, if the density is less, if the thickness is less, it might look at that time that it is not very naturally implanted. But when it's in a desired density, I think at that time we should evaluate the frontal hairline. Now you see that it is very dense, it's very good, it's very irregular, it's not very perfectly straight, it's not very artificial, so it looks very good, and density is very good. And he I think find the right style for his face. I think his model, his style is good too. And the other side, okay, so you can see also the sides extraction parts. So it's good. So happy patient, happy result. We are happy too. Thank you for watching us, and thank you for having time with us. If you have some questions, please write on the comments below. Thank you.